Dr. Dressel and his ethics in dentistry. And Dr. Dressel lived his life and was well defined by his high ethical standards. So now we'll introduce the speaker, who is Dr. Kim Harms, and perfect for this lecture because one of the edicts of ethical dentistry is do no harm. So with that, we'll introduce the speaker.
Thank you, Dr. Barnes. You make everything fun. I'm now pleased to introduce our presenter, Dr. Kim Harms. Dr. Harms graduated from the dental school in 1981. She is an award-winning author, international lecturer, and a former national spokesman for the American Dental Association. Dr. Harms draws from 30 years of experience in both public health and private practice. She is an educator and has held many numerous leadership roles. Dr. Harms' mission is to help others gain knowledge and skills to work their way through inevitable loss, transition, conflict, and grief. It is my pleasure to welcome Dr. Harms to speak today. Please welcome her.
Well, hello, can you hear me?
Yes.
Back in the back room, you can hear me great. Well, I'm so excited to be here today, having graduated in 1981 with my husband, who's right back there standing up with the camera. We both graduated in 81, and it's just so wonderful to be back here. There was a little mix-up in the advertising. I do two major lectures. One is on pain in the brain, mental, emotional issues. The other one is on conflict management, and so they kind of got mixed up in the advertising. So you should have received a copy of the full 3-hour pain in the brain lecture that I gave for you, and then another conflict management lecture that talks about mediation. Because when you're in your practices, you're going to come across times when you have to solve conflict. And the number one thing, dentistry is such a great profession. We had a wonderful time all those years. It's a great profession. The number one problem that we experience at the end of our careers, if you look back and say, what was the worst thing? It's a conflict. The dentistry, really, you're going to be able to do it almost with your eyes closed, by the time you're out there 10 years. That stuff is not the hard part. The hard part is managing people. And your patient is a person. So we're going to talk a little bit about how do we take care of people, especially those who are suffering from emotional loss, from grief, from anxiety. Dental anxiety, I travel a lot, and dental anxiety is present all over the world. It's pretty universal. How do we manage those patients? And we're not just taking care of the teeth, we're taking care of the patient, behind the maxilla. So we're going to talk about that today and work on some of those issues. So first of all, let's take a look at what do the patients see. We have a patient. Our patients know. Most people have a little anxiety, so they know going to the dentist might not be their favorite thing to do, but they're willing to put up with anything they might have to go through because they want to get their teeth fixed, right? So it's a little bit of a silent bargain when they come in that they have to go through, maybe a little discomfort, but they get their teeth fixed. So they know that up front. But what do we do, with the patients? So we bring our patients in and we walk them into our waiting room. No, it's not a waiting room anymore. It's a reception. Sitting reception. And then one of our assistants comes and they call the patient, and bring the patient back, and they bring the patient back to the dental operatory. No, it's not a dental operatory, it's a treatment. So up until now, you get treatment room, reception area, then we sit them down in a really, really nice, comfortable chair, right? They're sitting down in a nice, comfortable chair. And up until now, they have, no indication, if they didn't really know, what's going to happen. But then we do something that foretells a little bit of what's to come, right? We put on a napkin with plastic in the back, right? And we don't just lay it there, we clip it on. We put that napkin on because we know something's going to happen here and we want to make sure that's protected. So that's a first indication. But they're usually pretty good with that. Then we lay them back in the chair, right? They're laying back in the chair, and all of a sudden we hit them with a bright light. Right in their eyes. Now, we used to have sunglasses, safety sunglasses, and that was really great. So I would recommend that. But they're hit, even with those on, that bright light is hitting them right in the eyes. And then what happens? All of a sudden, one shadowy figure comes off to the left. And then another shadowy figure comes off to the right. And those shadowy figures don't look like humans. They've got googly eyes, those glasses are coming down there with those googly eyes, and you've got a mask across your mouth. And the only good thing about that is if you're old like me, I look just like I'm 20 because you can't tell the difference because everything's going on, so it's, good. But you get this man, you can't tell who's behind there. So they're sitting up there with the lights flashing in their eyes, and these two creatures that have kind of emerged out with funny eyes and masks and so on. And then what do? And we're the explorer. Where's the probe? What do? We have these sharp, scary instruments that we're using. So, what do we do to them? So the next step that we do is we prod, right? We poke, we prod, and then we drill. Oh my goodness, think about that. Think about laying down some part of our body, there's a drill going at a very high rate of speed, and as that drill is going, the worst part is the patient is seeing body parts spewing out, little tooth dust coming out and landing on that beautifully placed napkin that we just took care of, right? So there's a napkin there, so we were doing our job there. But this is what they go through, and it's like an otherworldly experience. Like we look like Martians. Look at that. We look like Martians. So it's something that they go through every day. But they agree to that. The patients agree to that. They agree to go through with that because they want to keep their teeth in great shape. They want to go over to Europe and smile and have everyone know they're Americans because we Americans have great smiles. So that's how they tell us who we are in Europe. So that's what they want. So that's an agreement. Up till now, even though it's a kind of a crazy otherworldly experience, it's good. But what happens if there's conflict in the room? Your dental assistant and you're not getting along? What happens if the patient has unusual anxiety? What happened if the patient just got a divorce yesterday? Or is going through grief or lost their father? What happens to that patient? Then that contract kind of doesn't work quite as much anymore. What happens if the patient walks up out of your room and even though you've had a great experience, you've done this great job, you perfect crown, everything fits, everything's good, they walk out of that room, they go up to the front desk, and the front desk person is a little on the passive aggressive side and gives her a hard time. What happens to the experience with the patient? That's when what could have been a fairly pleasant, extraterrestrial experience really turns into a nightmare. Because your patients are going to judge you by the lowest common denominator of how they were treated in your office. So the person at the front desk can completely eliminate all the good work you did in the back. So the important thing, and what we're going to talk about today, is trying to understand what patients are going through. And you are on the young side, so people that are on the older side go through different things in their life. So try to understand them. And the only way you're going to really get optimal treatment is if you understand your patients in an optimal way. And so the goal really is to help you understand the emotional needs of your patients. And the emotional needs, many times, are more important in your happiness than the dental needs. And we're going to talk a little about emotional pain in dentistry. So each patient comes to us with a unique history, right? We're going to talk a little bit later about some of the things we were taught in dental school that you would be sued for right now because that was just the standard of care at that time, which is different. It changes all the time. And most patients have some level of anxiety when they're receiving their dental care. And take a look at the newspaper reports and how often do you see dentistry portrayed in a negative light? Like, oh, it's worse things like going to the dentist. I mean, going to the dentist is not portrayed in a very good light. And so once again, optimal understanding of the patient is required before you can give them optimal treatment. Now, there are a number of personal losses that you can bear. You can have personal loss through death, through a divorce. There's so many things that can happen. This is kind of a long list of that, but people can have lots and lots of things in which they lose personally, personal loss. So how long is your list? Long life brings more loss, right? If you've lived a long time, you're going to have more loss. People my age have more loss than people your age. So long life brings more loss. Historical times influence loss. If you go back to Europe in World War II or Asia or any country that's suffering from war, you're going to find out personal loss is handled differently. Geographic home influences personal loss. I was able to meet Dr. Meeks out in Rwanda. I do some work in Rwanda, and we're going to talk about that a little bit later, but they are the kings of understanding how to recover and be resilient after personal loss. It's also important to know that every loss is unique. If you have a loss and you have a loss, you can handle them differently. You can't judge how people handle losses. And sometimes loss is complicated. Now, I talk with my hands, and some of you may have noticed that one of my hands is not like the other. I have a clipper here. And as much as I would like to say that, you know, I lost these fingers through some exciting thing like, you know, shark attack, or, you know, maybe, you know, piranha or something like that, that wasn't the case. That's not how I lost my fingers. When I was born, the first thing that the nurse said was all 10 fingers and toes, and then so they got lost somehow. I don't know what happened to them. But the most common, most probable reason is that when my mother was pregnant with me, she took a drug called thalidomide. It was not out on the market yet. It was still being tested. It was in the Cincinnati area. Her friend was taking it for morning sickness, and back in the 50s, you know, you just gave each other whatever drug you had. So she got some thalidomide to help her with morning sickness on the way from the East Coast to the West Coast, and